go? Or
Yes. So, Rahul, I wanted to know your perspective. From a COVID, do you think COVID, and there is a raised awareness in people now with respect to hygiene, with respect to health, a lot more than what existed pre-COVID, because Indians usually have this chalta hai attitude. We are a strongly religious country, which means we have a faith system, a belief system in place where everything happens only to somebody else. We call that the optimism bias, right? So now I think that's changing slightly. Of course, on the
yeah,
roads in Hyderabad, at least I don't see it yet. There are still
yeah,
people going trippies on the bike without masks. But I
yeah,
think overall, generally, the population has become more aware of health and health
yeah.
related. Do you think people's acceptance of another option they have for their loved ones in terms of an air ambulance would increase from now on, if it hasn't already?
Yes, of course, and I think we have already done it, and which has come out in the media as well, where we have taken the risk and transferred active COVID patients for the first time as well in India. So these patients, were actively COVID, they were fluoridly COVID, and they were, positive. All the tests were positive. We have imported these special isolation pods.
Wow.
Rahul, you there? I think Hyderabad. Power cut. I kept telling Chandrababu Naidu took electricity and also, the Wi-Fi, whatever, internet connection.
With him, is it? But let me tell you, I am in Bangalore and Hyderabad both. Uh, I think we've lost Rahul temporarily. I'm just going to pause record.
Okay. So yes, uh, the perspective of COVID, the way we have tackled COVID, or the way we have fought in the war against COVID, was to to stand shoulder to shoulder with our other doctor brethren, if we can call it, by taking the challenge of transferring these COVID patients in an aircraft. Now, if you imagine a COVID positive patient in an emergency room or in an ICU, it's a big place. In an aircraft, it's a confined space, so you are more exposed to the viral load,
Right.
right? So we geared ourselves for that. We did our homework, geared ourselves for that. We got these special isolation pods from Germany to contain the virus within the pod by by introducing this patient in the pod, and
Right.
in a very stable condition, although they were very highly critical.
Right.
So it took a lot to pre-optimize and prepare the patient to be introduced in the pod, because once the pod is sealed, it cannot be opened. Otherwise, we risk ourselves to be exposed.
Right.
And we did that for the first time in India. We transferred a fluoridly COVID positive patient from Calcutta to Chennai successfully. And after that,
It goes more to the pilots and airport staff as well, Rahul. That explain that.
yes, yes.
Yeah.
We exposing the pilots, the flying crew, as well as the medical crew. It was our responsibility. It not only our moral responsibility, but our actual, our as leaders of this company and the organization, it was our responsibility to make sure that everyone was safe.
Right.
And we did that very effectively. Secondly, now we are seeing a lot of young people, as Shalini was mentioning, doctor friends and colleagues, being exposed to COVID and suffering from it. They go into this lung fibrosis, the lung injury which happens because of COVID.
Right.
And even after the COVID has left their body, the lung fibrosis continues, and that causes a lot of mortality. And that we are seeing a lot of people die at a very young age because of that. And then the only way to tackle that is giving the lungs some rest to recuperate. And the way you do that is by introducing a bypass called ECMO,
Right.
where you're taking the blood out and purifying it and pumping it back. So it's called a bypass machine, or in our language we call it ECMO, and giving enough time for lungs to recuperate. So it's a bridging to recovery, and we have specialized in that in the way that no one has, probably, because we have developed this concept of a rapid ECMO service. where we fly out a crack flying ECMO team, which is a 4-member ECMO team, highly specialized doctors and perfusionists and paramedics. 2 doctors, they can immediately put lines in and put the patient on an ECMO. And in the last 14 days, we have done 10 ECMO transfers. We are almost flying 1 ECMO per day over the last 2 weeks. Right. And all these, and more than 50% of these were doctors, right, who were facing the corona on the front line, and basically suffering from that. Right. And more than 50% of these cases were in an emergency. ECMOs are not done in emergency. They should not be done in emergency. But we had no other choice but to do that. And we are writing a case series on the type of challenges we faced, including crossing the border of Nepal by road and taking a chartered chopper from the other side of the border to rush to get a ECMO done on an Indian national in Kathmandu. Right. So, we are very proud of taking the challenge, taking the bull by its horns, right, and facing the corona challenge, and getting involved in that, in the war against corona in our own unique way. Right. Right. We are put ourselves.
It took a lot for us to convince the airport staff and the pilots to do these transfers. As Rahul said, like, it's very challenging environment inside an aircraft, and the pilots can't wear PPE, fly the aircraft. So they will be in their own dress, because they have the issues with the communication, the ATC and things like that. Right. So getting them to convince this isolation prod is 100% protective, which they'd never seen in their life. And according to them, I'm not a doctor, why should I put my life at risk? But having said that, the doctors were all wearing PPE, so they were not at such high risk. And the ground handling staff, like a number of airport staff as well, who come to clear and things like that. Right. So it was extremely, it was not challenging. It was like a mammoth task to get them to agree and convince to do this. But then once we did that, then there was no stopping.
Right. And I can say that with confidence, especially about Shalini and I, we have slept less than 4 hours in the last 6 months since the corona started. It's non-stop, and we don't get tired, because we find it challenging and exciting as well to get involved in such challenges where no one have ventured before. So
I think before you realize you need to sleep, there'll be something else. So I don't know whether we enjoy it, but there is no time to even think that we enjoy it.
Right. Yeah. Often what it takes one to become a doctor, right? It's not easy. It's one of the toughest fields of education. It starts from there. To how much effort you guys put in is underrated, often insanely criticized. But what you guys do is definitely, you're the unsung heroes for the nation. Moreover, the both of you are becoming the unsung heroes of the unsung heroes as well, in a country which probably lacks infrastructure quite a lot. And talking about infrastructure, do you see yourself partnering with teams like NDRF, right, the National Disaster Recovery Force? Because often, like the recent Hyderabad floods as well, there were a lot of cases of pregnant women. There are a lot of cases of elderly people struggling with floods. And these are not national level disasters, but for Hyderabad, it still was a difficult time the last couple of weeks. Do you see yourself playing more of an active role with the governments in the future?
We already done that. Oh, I think like we keep on saying the very first. You get bored and sick and tired of that word, because we keep saying this very first. So when the Kerala floods happened in 2018, right, the first time in Indian history, civilian chopper was pressed into action to airlift these patients or the people from the relief camps. So there are 2 types of evacuation that happens whenever there's a disaster. One is a case evacuation, that is a casualty evacuation. Other one is a medical evacuation, medevac. Casualty evacuation was done by the fishermen. I always take their name first because they played a very big role, and the Indian Army, Air Force, and people like that. And the medical evacuation was very challenging because the roads were clogged, and there was no way these relief camps had access to the healthcare system. They're all manned by a doctor, but the doctors had limited capacity in terms of dealing with patients, as they were not all clinical doctors, some of them. Along with that, they didn't have infrastructure, they didn't have hospitals to look after. There were nearly 10 lakh people in these relief camps. And the only way these emergencies in these relief camps could be brought to the tertiary care center, which was only Trivandrum, which was operational, was by chopper.
Right.
So we proved the concept of helicopter emergency medical services the first time in India. We also proved that how a chopper or a flying ICU can be used effectively during this flood reliefs, and how government, without spending a pie, where because this was done with our personal money and also some foundation money we got from a Satsai Foundation. So we proved that if we just, there's a will, there's a way, and we can do this, and we can still do and join hands with the Indian government, the Army, Air Force, in NDRF to execute this very successfully.
In fact, thank you
Rahul,
for,
you'd like to add?
taking that name before I come to Rahul. Thank you for taking some names there, Dr. Shalini, because that was my follow-up question. Because I've been visiting Puttaparthi since childhood, and I know the hospital there provides everything for free without perhaps any support from the government, right?
Yes.
And seamlessly through the last at least quarter of a decade, if not more. Quarter of a century, if not more. Do you see that happening more and more in terms of partnerships with organizations that already have funds collected for this purpose? So Rahul, maybe this you can.
Rahul. Yeah.
Yes, I mean we do see a lot of opportunities for organizations like these, as well as religious institutions, as well as government organizations, because what we proved in Kerala was that we can deliver this free to the people, to the people who actually need it, and it was effective in saving lives. Sai Gramam Foundation really helped us in that. Plus, we poured in all our savings into these operations, but we did not charge any money. Now, in terms of operating a helicopter-based service, the type of money that is required is negligible compared to the funds that these organizations see in their bank balances, as well as these religious institutions see, as well as the government have funding for. And that is where we come from, that these are not astronomically high price tagged services, that we can render this service for a fraction of the money that they would normally spend on getting mobile medical units or ambulances, or and stuff like that. So yes, we do see a lot of synergy. We really are seeking out to religious and other organizations like this. In fact, we have our own ICATT Foundation. Wow. And Shalini is a big philanthropist, and she's heading the COVID India campaign, which has facilitated the donation of more than 4 crores worth of PPEs and other COVID-related fighting equipment. Plus, she started a plasma donation campaign called COPE, where she's involved in facilitating a lot of plasma donation and treating a lot of patients through that. So that is what we have come here for. That is what excites us, and and we are obviously seeking out to go into partnership with institutions and religious organizations because we are trying to achieve the common goal. We are
I think more in terms of national disaster relief fund, things like that. Of course, yes. As Rahul said, there's a lot of synergy, and it will become a service which will be interdependent on each other. And more we prove this concept, I think there'll be a lot of value add to what they do in saving lives and also making a difference.
Right. Yeah. Because when we positioned our helicopter in Kerala, we were under the direct command of the Southern Air Command. And we got ourselves tuned to working with the Air Force and the Army and the NDRF. So it was quite exciting.
What we got from the government and all the other military and Air Force was a blanket permission to do what we wanted to do. So it just proved that you don't need money to do it. It's just a cooperation of all the different stakeholders is what it matters, including the collector, to the Chief Minister of Kerala gave us a hand in doing this, rendering the service. So
Right.
it was magnanimous. Like without financial help, we were able to render this. I think it just all the having the right people, right-minded, especially a state like Kerala where people are educated, made a huge difference to us.
Right, right. So I'm curious to ask both of you this, right? So within my networks and my friends' networks on social media and otherwise, we have more than a few million people that we are connected to. And you are here trying to do something which is more of a service than anything else to the nation. If there were, if there was anything that all of us could do, right? My viewers, my networks, my friends, what is it that we can do for you?
I think first and foremost, something very passionate to both of us is organ world. We do airlift in the highest number of organs in India.
Right.
And 80% of the people registered to be organ recipient die before they get the organ.
Right.
And if you ask the this like regional organ transplant organizations or the national organ registries and things like that, they say it's purely because of lack of logistic support.
Right.
Before we came back to India, 90% of the organ which were eligible for transplant used to go waste, because absolutely there was no way people could connect it up, because organ airlifting or organ transport requires an in-depth knowledge and commitment, 8 hours of work non-stop, 4, 5, 6 WhatsApp groups running, and timing is such a big thing, because heart has got only 240 minutes to live outside the body before it gets implanted into the recipient.
Right.
So when it comes to this, at least 80% of the people are dying before they get the organ. If you look at it in a very cynical way, every 4 minutes there is a road traffic accident death, and each one of them could have been qualified as an organ donor. And also, again, very proud to say that until today, whatever the organ has come to us, not even one single one we have wasted. We have successfully airlifted every single one of them, despite the challenges we face from the airport authorities, from the donor family, from the recipient hospitals. Million logistic problems come into place,
Right.
but we have successfully airlifted all of them.
Right.
So when this is the issue, and I think we have to make every organ recipient be able to afford this airlifting. And the only way of doing it is people like you, the philanthropists, have right attitude towards life, or towards the society, probably can contribute to this organ airlifting world. And because I think government will be able to take care of the road traffic accidents, the organ world is one which lacks support. And
Right.
I think expecting everything from the government is a shame. We have to chip in whatever possible in every possible way. That's the reason why COVID India campaign, the third force, I'd call it, came into a big picture and helped hospitals in terms of bridging when the government supplied. And we only supply to government hospitals. So
Right.
the 4 crore worth looks very small in front of the what government did, but still it came into saving a lot of saviors. Like, we call them Save Our Saviors, SOS campaign.
Right.
And so I think that is where we require a helping hand in
Yeah, so I will just continue where she left off. So, yeah, so we will definitely need help from entrepreneurs, and also your through your networks, if they can contribute towards free organ airlift for the people who have these transplants done in government hospitals.
Right.
The private hospitals can pay for themselves, but the private the government hospital, the transplants happening in government hospitals, the recipients don't have enough money to afford an airlift of an organ, and the heart and lungs do need an aircraft to bring them to the tertiary center.
Right. Right.
Yeah.
All right. Thank you. Thank you. It's truly inspiring stuff. Yes, there are a lot of people out there who would love to help you out, because you're doing this for a noble cause. India needs this. And as a nation, when we talk about being Atmanirbhar, this is one of the critical things that we need to be absolutely self-sufficient, which is to take care of our people and see if we can stop people from dying. So thank you, thank you, thank you for sharing all that you've shared. In fact, my viewers would know this. This is perhaps the longest interview I've ever done. Just so you know, our average timing for our interview is 20 minutes. This has crossed 1 hour, but I'm going to release it as is without editing, because I think people need to know some incredible work being done by our own countrymen when they had a choice, that they didn't do this and made tons of money. And that's what makes this truly an inspiring journey. And their story, rightfully so, has been reported in a book called Dhool, Dhoop and Dhakka. You've heard through the last 1 hour the Dhool, the Dhoop and the Dhakka that Dr. Shalini and Dr. Rahul had to go through. So if I were to ask you one question, Dr. Rahul and Dr. Shalini, one word that explains your journey thus far, just one word. If you were to talk about one word that explains your journey thus far, and one word as a message to our audience if they want to start up something in their life. So I'll go to you, Dr. Shalini, first. One word that explains your experience.
Perseverance.
Perseverance, okay. And Dr. Rahul?
Exciting.
Exciting, excitement, exciting. And one message. So if somebody were to start something in a similar field or something where nobody has treaded before, what's your one word message for? What should they do? Dr. Rahul, I'll go to you.
Yeah, I would say perseverance. Do not give up.
You've interchanged that now. So Dr. Shalini, what is your one word message?
There is, okay, one word.
Oh, you can do a sentence, that's fine.
Okay. I always say there is no alternative to hard work. Hard work with ethics, it'll always take you where you want to.
Absolutely. Amazing that you say that. Hard work without ethics takes you nowhere. When you add a noble cause and care for your other countrymen, it just makes it even bigger in terms of things to achieve. Dr. Shalini, Dr. Rahul, been a pleasure. This Friday night, I am signing off with a feeling of high. Thank you for inspiring me. I've been procrastinating quite a few tasks the last week because I've just been plain lazy. Listening to your story, I think I'm just going to go with such high-spirited intent to finish them as well. Thank you so much for spending this time. A big thank you from all our viewers and all my friends and all my networks for doing a wonderful job and the service to the society. God bless you both with many more. May you save many more lives in India. And may I see you up there making this a legal entity within the government of India very, very soon. Good luck. Thank you.
Thank you.
Hopefully I'll get to meet you lovely souls soon. So thank you for your time.
Thank you
very much. Thank you very much.
Thank you.